The next two pathogens we're going to talk about are Actinomyces and Nocardia. These are the two gram-positive rods that are branching. Remember, we talked about those earlier. And what I'd like to do, because a lot of the times these organisms are contrasted with each other and compared a lot to each other, I'm going to do that for you now, and then I'll go through each of the different facts for each of the organisms. Now, Actinomyces is the A of our ABCs of anaerobes. So we've got Actinomyces, we haven't talked about Bacteroides, and we've talked about Clostridium. So Actinomyces is anaerobic, and Nocardia is aerobic. All right, so that's one of the differences. Number two difference is that Actinomyces is not acid-fast, but Nocardia is at least partially acid-fast. All right, so that's difference number two. Difference number three is that Actinomyces is part of the normal flora. Therefore, many of the infections are endogenous. Whereas with Nocardia, we're talking about exogenous infections. All right, so that's kind of your compare and contrast for these two. And now I'm going to stick to Actinomyces, and we'll kind of go through the distinguishing features here, and then we'll move on to Nocardia. Now, the species we're going to talk about predominantly is Actinomyces israelii, which is most often associated with disease as far as the Actinomyces. You can see in this gram stain that I'm showing you that it's definitely a branching rod, but you can see the deep kind of purple coloration, meaning that it's gram-positive. And the reservoir is basically normal flora. So you can find it at many different sites throughout the body. You can find it in the mouth. It can be part of the vaginal mucosa, for example. Therefore, transmission for Actinomyces is typically endogenous. And again, being an anaerobic organism, we're looking for growth in tissues that have what? A reduced oxygen supply. All right? Now, the disease for Actinomyces, typically, one of the things we're going to talk about is abscess formation, all right? With anaerobes, one of the things you want to remember is a lot of the times they cause abscess. Number two is a lot of the times they're polymicrobial, so they're mixed infections. And three, they reek. They smell so bad that when somebody has an anaerobic infection, you are going to know just from the smell, okay? Now, when you get to the disease, so look down at the bullet point here, number two, you'll have the swelling and then the draining abscesses. So the abscesses will drain, and what you'll find in the exudate from those draining abscesses are something called sulfur granules, all right? Sulfur granules are diagnostic for Actinomyces, and I will talk about that a little bit more when we get to the diagnosis. Now, you look at all the different bullet points here, you can see all of the different types of diseases that can be caused by Actinomyces. Probably most high yield, okay, and tested on the USMLE is lumpy jaw, okay? And that's what I'm showing in this image. So you can see this patient with a lot of swelling in the jaw area. And what will eventually happen with this abscess is it will begin to drain. And the exudate that is expressed from that abscess contains those very diagnostic sulfur granules. So we'll talk about those in a little bit. Now, your pelvic infections, thoracic infections, abdominal infections, again, it could be other organisms in here as well, especially abdominal infections with an anaerobe. You can also think Bacteroides. So lumpy jaw really kind of sets itself apart there. Now, CNS infections, again, I wouldn't say that this is super high yield, all right? But Actinomyces can get to the CNS. And again, we made that kind of compare and contrast for Nocardia. And in this case, Actinomyces will give you a solitary abscess of the brain, whereas Nocardia, you have multiple focal points of that infection. So that's another way you can compare, because both of those organisms can get to the CNS. All right? But for the boards, for step one, we're thinking lumpy jaw. All right, we're thinking diagnosis. We're going to get some of that exudate, look at it under a slide, and we're going to see those sulfur granules. We can also gram stain the organism, and we'll see those branching bacilli like I showed you earlier. And what else is kind of interesting is if you grow Actinomyces in culture for a week, the colonies actually look like one of your molars. So it looks like a molar tooth. That's very diagnostic as well. Okay? Now, treatment for Actinomyces, of course, we're going to use antibiotics. Ampicillin or penicillin is typically the DOC for Actinomyces. But again, with the abscess formation, we're going to include in that treatment regimen surgical drainage of that abscess.